Hi, I'm Dr.Parinaaz Parhar. I'm the clinical head at Oasis Fertility, Secunderabad. Today I'm going to be talking about the various options available for fertility treatment. First, we have something called as an ovulation induction treatment. Ovulation induction treatment is a simple and non-invasive procedure which usually involves the administration of medications to stimulate the ovaries to cause the release of a mature egg. It's a simple treatment which helps in correcting mild forms of infertility, and it usually has a success rate of about 5 to 10%. Next step is something called as an intrauterine insemination. For patients who are having mild to moderate form of infertility, and usually those who have unexplained infertility, also patients who have some sort of moderate form of male infertility, these patients will usually benefit from something called as an intrauterine insemination. This usually involves the processing of the male partner's sperm and releasing it into the uterine cavity during the fertile window as close to the ovulation as possible. This simple procedure usually has a success rate of as much as 10 to 15%. The third treatment option which we have is something called as an in vitro fertilization or IVF. The IVF is something which is very popular and extremely successful. IVF usually involves the administration of medications to make the female partner's eggs grow. Once the eggs reach a certain size, they are retrieved from the ovaries. They are fertilized with the male partner's sperms in the laboratory. The embryos which are formed are cultured for a couple of days, and then they are transferred into the female partner's body. IVF is an extremely useful treatment option for patients who are having more severe form of infertility, especially those who are having blocked fallopian tubes or patients who are having severe form of endometriosis, diminished ovarian reserve, or severe male factor infertility. The fourth treatment option which can be used is something called as an intracytoplasmic sperm injection, more popularly known as ICSI. ICSI is a very specialized form of treatment. This is very helpful in patients having severe form of male infertility or those where you have only 1 or 2 sperms or sperms which have been retrieved directly from the testes. ICSI is a very precise treatment which usually involves the introduction of a single sperm, rather the injection of a single sperm into the egg. This treatment is usually used in conjunction with IVF. The fifth option is that of using either donor eggs or donor sperms for conceiving. Now, patients who have exhausted all the other options for fertility and are suffering from really severe forms of infertility usually benefit from using donor gametes. What is done here is, in the case of donor eggs, the donor's eggs are usually combined with the male partner's sperm in the laboratory, and the embryos which are formed are then transferred in the recipient's uterus. Whereas in the case of donor sperm, a sperm donor's sperms are used in order to fertilize the female's eggs, and again the resultant embryos may be transferred into the uterus. As far as using donor sperms are concerned, with patients where the female partner has open tubes, we can also use a donor sperm IUI in order to give the patient pregnancy. The last treatment option which is available is something called as surrogacy. Surrogacy is a treatment option which is usually resorted to by patients where the female partner is not able to carry a pregnancy to term or is suffering from some uterine anomaly which makes it difficult for her to carry a pregnancy.